Good morning. Good morning. Hi, Brooke. Hi, Crystal. Look at you guys being the first in here. I'm actually trying out a new laptop of mine. I just set up my streaming software on here, so I'm wondering if I sound okay, if it's laggy. Let me know how it looks and how it sounds. Hi, Stephanie. How are you? Sometimes I like just being on my laptop because I don't have to sit at the desk. I get tired of sitting at a desk. Hi, Jenny. Hi, Rachel. So it sounds great. Okay, cool. Cool. Hey, girl. Hey. So, did everybody get notifications? I had a problem yesterday, or last night, I should say. I had Mel and author Tanya Hagen on, and I can't remember what I was gonna say. But anyway, if you missed it, replay it. We did get off topic a lot, which tends to happen with Mel and I, which is fine. Um, and that happens in live streams. People get. I've got some comments like, "Oh, you know, keep the small talk to a minimum." But it's like when you're on a live stream, it's different. I would never, y'all can't hear me. Can you guys hear me? Oh, it went offline. What the fuck? See, it was doing this last night. It was cutting out. It was kicking people out and then they'd have to come back. So I don't know. It's not. I wonder if it's my internet. And I just turned my mic up. So tell me if that is better, Rachel or Jessica. Okay. I might have to play around with my settings a little bit, but if you guys can hear me now, let's talk about this. I've been following this very closely. Okay, I've been following the videos that were released from China. I did a live on that. Hi, Amanda. I did a live on that. Hi, Girly Gamer. Yes, so let's talk about the store's mind crime. She said her husband is ill and she can't find any medicine. Okay, so thank you, Charlotte, for that. I love hearing positive feedback about that. I mean, the live just flows, and sometimes it's like you just go with it. You have to. You have to. But I want to show you guys a picture of my local Walmart. So let me show you this. And luckily, I went to Dollar Tree and freaking bought a bunch of hand sanitizer. But, like, this is what the Walmart looked like here. Let me zoom out here. It doesn't look as bad when you have it blown up, but the shelves are cleared out of all freaking sanitizing products. Yeah. People are freaking out with good reason. With good reason. And hi, Caslin. And it makes me wonder, what is going to happen when a lot of these products that we get from China are not shipped here anymore. And I think that, our government and our country as a whole needs a wake-up call as to, how much we depend on China for goods that we need, our medications, our clothing. I mean, everything that we have pretty much is made in China. And I know we've all talked about this for years and years about bringing, manufacturing back to America. This is in Florida. The picture I'm showing you right now. That is our local Walmart here in Florida. But when I did my live a couple weeks ago and Prepper came on, Prepper 101 is a prepper. And if you guys don't know what a prepper is, it means he's prepared for, any kind of catastrophe that may happen. And he said, get your medicine now. Oh boy, no, I'm sneezing. We have been way too dependent on China. And, when Trump was originally elected in, that was one of his big talking points. And I think that with all of this going on, that he has a good chance. I think he's going to get elected anyways, but even a better chance because he has been an advocate for, manufacturing here. Thank you, Jessica, for manufacturing here and limiting some importing from China. So, closet prepper here. Yeah, I mean, you got to do what you got to do. So I want to show you guys a video really quick that I came across this morning. And I'm not trying to instill fear or panic at all. I'm just showing what I find and what I see. Because not everything is, reported here, and we know that. We don't see everything, unfortunately. I mean, we're nothing like China, don't get me wrong, but there's always agendas with our mainstream media. There's always an agenda as to whether they show us something, and they always put their spin on it for whatever reason. So I just like to look for myself and not just rely on the mainstream news. And that's why when my son showed me those videos coming out of China of, what was his name? Fang Bin, or which I think he's still missing, which AKA his government probably killed him. But that's why I was so fascinated by his videos, just because in a communist country like that, it takes tremendous balls to make videos like he did. And to have the government, pounding on your door, threatening you. It's scary. It's scary stuff. But I'm going to play this video really quick. This is about someone in Seattle. It's a little shocking to hear where this person worked and tested positive for coronavirus. So let's watch this video real quick. Hopefully my audio works okay. So let's do this.
First, though, we're following breaking news in just the last 30 minutes on coronavirus. Amazon confirming tonight that an employee at its Seattle headquarters has tested positive for the virus. I'm Joyce Taylor.
I'm Greg Copeland. Let's get straight to King 5's Ted Land. He's live at the specific building where that employee worked. Ted?
Hi guys, this is a big office building right here in South Lake Union where hundreds of Amazon workers have offices. Here's what we've learned just within the last hour. This worker came to this office building last Tuesday. Amazon says the worker was not feeling well and they went home from work sick. They have not been back to the office since. Today, Amazon says it learned that employee tested positive for coronavirus. So they made that announcement this evening, and today and in the coming days, Amazon is tracking down all of the workers who came in within close contact with this person. So 6.5 feet or less. They want to talk to those people and make sure they're self-monitoring and taking further steps for their own health. They say anyone who was not in close contact with this worker is at low risk of transmitting coronavirus. So again, a worker here at the Brazil building on Amazon South Lake Union campus testing positive for coronavirus. We'll have more on this on King 5 News at 9, 10, and 11. For now in South Lake Union.
Ted, thank you. Also tonight, word that the firefighter stair climb and the big climb Seattle will be postponed. The Leukemia and Lymphoma Society says it's making this decision out of an abundance of caution, prioritizing the safety of staff, volunteers, and the public.
Okay, so an Amazon worker came into work, was sick, went home, and has now tested positive for coronavirus. And it's just like, it just keeps getting worse. I mean, Megan says, I am in Seattle area and it's so concerning. They have designated an old juvenile detention center less than 5 miles from my house as a state quarantine location. Wow. Wow, girly gamer. Yeah, I mean, we went to Disney World a couple weeks ago. And I'm not gonna lie, I was a little freaked out about coronavirus, and we all had hand sanitizer, and we brought wipes and all that with us. I did not see Disney doing any extra cleaning or sanitizing of the rides. You get in, you instantly, you grab that bar. And I didn't see them wiping those down. So I don't know. I mean, the first place that was closed down in China was Disney World. Disney World Shanghai was closed down. Hi, Gingy. There was nobody with masks on. I didn't see not one mask. Ocean Lover, not one. So it was real easy to kind of forget about it when you were there. You're at Disney World, you're in the moment, you're having fun, you're going on rides. I have to admit, before I went, it was on my mind. When I was there, not so much. Not so much. Right next to a dairy farm. Yeah, that is. It's concerning, for sure. I don't like it. I don't like how it can be. It's now here being spread in the community. It's not even just, related to people that traveled anymore. Now it's people are diagnosed and they haven't left the country. There's old people in nursing homes that have gone nowhere and they have it. There's 4 people in a nursing home, I believe it's in Texas, that have died. And now all the first responders that were there are quarantined because they were exposed to it. I mean, that's the scary part, is how quickly this can be spread in the community. And then I asked my boyfriend's daughter, what is your hospital? She works at a hospital. What is your hospital doing to, prepare? Nothing. She hasn't heard anything. So that's kind of scary to me, because a lot of medical workers are being quarantined that have treated patients. And it's just, it is scary. I mean, I think generally healthy people are, recovering just fine. It's the elderly, it's the people with compromised immune systems that are dying. My husband's aunt went to Paris 3 weeks ago, came back Wednesday. Now she has a cold, she thinks, no fever, but has a cough. I've been trying to get her to go to the doctor. She hasn't gone yet. Well, if she was in Italy, I would definitely go to the doctor. But the thing is, I don't think these doctors have test kits. So it's kind of pointless until there's test kits. I would think if anybody's sick, you should just treat it just like you would if you were sick with the flu or a cold. I mean, you obviously don't want to spread that. Stay home, sneeze in your elbow, don't sneeze in your hands, don't not cover your mouth. I mean, that is exactly how it's spreading. People are sneezing, people are coughing, and they're not covering their mouth. And there you go. So I think we all need to just be diligent, just like we are if we're sick with anything else. And I don't think they're going to have a lot of test kits for a while. I heard on the news they're preparing test kits. And they're going to have, I know in Florida here, they're going to have 3 cities that are state mandated testing facilities. One is in Tampa, one is in Miami, and one is in Tallahassee. So I know for my state, those are going to be the testing areas. And, you know, it can't hurt to look up your state and see what your state is doing to prepare. It can't hurt to be prepared. You definitely want to be educated in case something happens and, you know, you're freaking out, you don't know what to do. You know, look up what your state is doing. Look up what, you know, they want you to do if you have symptoms. I mean, there's people calling 911 and going to the hospital thinking they have coronavirus. So I think the more that we're prepared, the less panicked we are if we're prepared. So I gotta find another video I wanted to show you guys. I've been following the World Health Organization, just because they are the ones that are kind of putting out these briefings. Let me show you one, the latest one. Now, they're having daily briefings. And this one, risk of coronavirus spreading globally, now very high. Okay, this is, I think, the one, make sure it's in English. Yeah, okay, here's the video. Let's watch this and then discuss. The World Health Organization is going to be a really good source if you want updates, because this is where they're collaborating. They're getting all of the info from these different countries, and you can see on the wall, they have the map pulled up on the wall, and they have, you know, their outbreaks there. But these are the guys that are kind of the middleman. So we know we can't count on communist China to give us accurate information. So the World Health Organization is put in place to kind of be a middleman for this information and to analyze this information.
The continued increase in the number of cases and the number of affected countries over the last few days are clearly of concern. Our epidemiologists have been monitoring these developments continuously, and we have now increased our assessment of the risk of spread and the risk of impact of COVID-19 to very high at global level. highest level of alert or the highest level of risk assessment in terms of spread and in terms of impact. But that is not in order to alarm or scare people. And I think this is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready.
All right, so what do you guys think of that? Like, what do you think of this information? Check out Dr. John Campbell. I'll have to look him up. Okay, let me go back and chat. Let's see. Yes, and wash your hands, Watt says they're starting to think this whole thing is a hoax. Why do you think that? Why do you think this is a hoax? I mean, what would be the point, I guess? What would be the motive for this to be a hoax? Just Ellie says, our government response to the situation isn't easing my anxiety about this either. Now, I have to agree, because it doesn't seem like they're taking it as serious as the World Health Organization is taking it. When I hear the World Health Organization talk, they're very serious. And they're saying this is a wake-up call to governments in every country. Be prepared. Clean your money. Ocean Lover says, I hate to think of the idea of being trapped in my home at some point. You know, so many people in these other countries are working from home. They have had to set up at, working out of their house. Scarlett says, I believe they have test kits in New Jersey and New York. In the event that the school needs to close. Jay, I can share it with you. Share it with you to block out the location. Okay. Yeah, I hope the mail doesn't either. Now, I don't know how long coronavirus can live on something. That I'm not sure. So if someone sneezes on your package, how long do those droplets have like live virus in them? I don't know that. Rachel, yes, I thought that was that made me cautious too. I've been watching a couple, David Abel, who are quarantined in a Japan hospital. They were on a cruise line that was docked in Japan a few weeks ago. They keep getting tested and go live every day. Hi, Miss Murder. Jennifer, I put my mail in a baggie, spray it outside, wipe down everything else. I do not answer the door. If I go out, I wash my hands and take a shower returning. I can get pneumonia easy. I am 57. Hi, Casey. Jay, did you see the Queen's kid on the sidewalk? No, I don't know what that means. Dark Joker. I agree. Everyone should be prepared to shelter in place. You should have enough food and supplies for at least 3 months, including medications. I mean, I see these images of these people in these suits and these shields over their faces, and to me, That's pretty fucking scary. Casey says, sorry, what I was trying to say is if you fly anywhere, you need to immediately shower and put your clothes in a bag. Or wash them immediately if you can. Never sleep in a bed after flying. Absolutely, Casey. Wash the airport off you, right? Jessica Cruz said, I heard 9 days on hard surfaces. If this can be spread through the mail, we're in frickin' trouble. We are in trouble. I mean, how many days does it take to get a package from China? I mean, who orders on Amazon? Guilty as charged right here. And some of that shit comes from China. So that, I haven't heard that we're at risk through the mail. But if it can live on a surface for 9 days, I'm not really sure. I'm not really sure. I mean, that's a good question, though. Sure, Scarlett. I'm going to put it in chat for you. It's jisforjustice@gmail.com. Miss Murder said she ordered her shopping. 1 out-of-stock item, hand sanitizer. Gingy Me just got luggage from China. Ocean Lover says, I won't order on Amazon right now. See, and I've been continuously ordering on Amazon. And I think a lot of Chinese suppliers actually stock up in Amazon warehouses because I've gotten goods that are from Chinese sellers like the same day or next day. So I think if they're stocked already, we're okay. It's just those new packages coming over. That's a little scary. I mean, the stuff that's already been stocked, I mean, it's been sitting there. So I'm not worried about that so much. Okay, it looks like my stream ended and started again. You know, Gingy, I have not done Zulily yet. And I'm almost afraid to go there because I probably will go nuts because I'm already an Amazon junkie. I have packages every day from Amazon, it seems. Another thing is if you have kids in school, not all parents are as vigilant as others and might possibly send their kids to school sick. True. Hey, Epitome. Live in the UK. What time is it in the UK? It's morning time here. I love morning lives. I'm drinking my coffee, hanging out with you guys. You know, I love it. I love it. Thanks for being here with me. Well, I'm gonna have to check out Zulily because I have a year-old granddaughter and I hear that they have cute shit for kids. Good morning, Terry K. My uncle was stranded in Milan where the outbreak has hit. He and 103 were able to leave on a Delta plane on Monday. They landed in New York and not one person on that flight was checked. See, that's scary as hell. So it's 2:52 p.m. Nice. Okay, so I also found this article. Okay, and this is about... Oh, a Daily Mail. Okay, let me go to Daily Mail. I'll pull it up. Hang on. The good old Daily Mail. They always have the scoop. Oh, let's not even talk about Super Tuesday. Looks like Biden won, huh? I'm not a Democrat, so I didn't really pay too much attention to that. But that's the main page on there. On the Daily Mail. Let's see. God, their website, they have so much on here. It's... I wouldn't even know where to find it, to be honest. It's not on the front page. All about the Super Tuesday. Go to news and see what that pulls up. Oh, is it the one, coronavirus will kill Britons, warns Britain's chief medical officer? That one? Well, people diagnosed in London, so they're freaking out. All right, let's watch this video of the chief medical officer in London, in the UK. All right, let's pull this up. I mean, the more that we can educate ourselves, the better, is the way I look at it. I'm not trying to be paranoid, I'm just trying to be educated on what's going on, and I think we have to be. We really have to be.
We have to accept that there will be more deaths.
I think it is certainly almost certain there will be more cases in the UK, probably a lot more cases, as the Prime Minister laid out, and we would expect some deaths, yes.
Okay, that was a little extra.
Today,
Of course, there might be some deaths. I mean, it's already happened, so that was kind of... So there's one guy in a mask crossing the London Bridge. Oh, here's a longer video with this guy.
Is that your gut instinct that, all right, you're going to be the chief medical officer, you're going to be careful what you say, but is your gut feeling is that we're going to have to deal with something pretty serious here? I think it is more likely than not, and I'd probably go further and say it's much more likely than not, that we are going to deal with a significant epidemic. How big it is, I think, is currently still pretty uncertain. But that there will be an epidemic, I think, is now highly likely.
So I know one of you said that your mother-in-law or something was in Italy, and from this video it sounds like Italy is one of the most affected countries. So I would be a little vigilant about that. A lot of people that are coming from Italy are infected. So it doesn't hurt to be informed. So I would suggest looking up what your state's doing, or just telling her, stay home. Just stay home and don't go anywhere if you're sick. Just like you would any other time, right? Always True says this is very scary. And I don't want to strike fear. I just want you guys to be aware and safe and to stay well. That's all. So, yes, the masks are only helpful if you don't want to get sick. Or no, that's wrong. They're only helpful for yourself. Like, if you wear a mask and you're around someone who's sick, it's not going to help you. Because that mask is not going to keep all of their germs contained. Crystal Dawn, don't forget to wipe your phone down to clean it. Last night, we went out to eat, and we went to Golden Corral. Didn't even think about it until I pulled in the parking lot, and I was like, oh my God. Coronavirus. A buffet. I'm not a huge fan of buffets anyway. But I do like Golden Corral. But I got a little freaked out. So I was like, oh, okay, I'm just going to go in and I'm going to eat and I'm going to be just like normal. Well, I wasn't, but luckily they had a hand sanitizer, mounted on the wall in there. So every time I went over to the food and touched a utensil to serve my food, before I ate, I went over and sanitized my hands, then sat down and ate. 6 total confirmed in New York now. Oh my gosh. Now, I mean, the number doesn't sound high if you look at flu numbers. But yeah, it's scary. So yeah, I just took the precautions. And, there was a hospital here that someone went in the supply room and stole all their masks in Tampa. So now the medical workers are low. And we have 2 people in the Tampa Bay area that have coronavirus. So they're asking people not to buy masks. They don't do any good anyway. So, I mean, I'm not sure how hospital workers are even getting around this if the mask doesn't stop the virus. So it's freaking scary. Yes, the flu numbers are much higher, and we lose people from the flu every year. We lose thousands of people from the flu, mostly elderly and compromised immune systems. But the scary thing about coronavirus is, with the flu, there's a 1 to 4. Yeah, that's what I'm wondering, Miss H. It's scary because you have it for 2 weeks. So there's 1 to 4 day incubation period for the regular flu, for the common flu that we vaccine for every year. So you get coronavirus, you're walking around for 2 weeks and you don't know you have it. So how many people are you coming in contact with in those 2 weeks? I mean, that's what's scary and alarming to me, is that if you think about, if you go out and do your shopping or whatever, how many things and people do you come into contact with? A lot. Hey, Apple Snapple. I get that they use the masks, but if they're not any good, how are they being protected? I mean, you see the people in China with the shields. Cat 101 says, glad I'm a pot smoking hermit. Amen, Cat 101. Keep doing what you're doing. You'll stay safe. But no, I mean, all joking aside, I just want everybody to be aware and be informed and, just kind of not be scared, but be aware, I guess. There's another site that I've been following, another channel, and it's called the Straits Times, and I believe this is out of Singapore, but they really have a lot of coronavirus videos as well. So here is the latest. So wait, before I play the latest video from the Straits Times, did you guys see the Pope coughing during his speech? Now, if that man was sick, why would they even put him out there? He hacked up a lung while he was talking, and they tested him for coronavirus, and he was negative. In case you guys haven't heard, if you saw the Pope hacking up a lung, which was really good timing for them to put him on TV, but he tested negative. He does not have coronavirus. But my God, just was bad timing, I guess. All right, this is the latest from the Straits Times, and And I've been watching them for a while now, too. So let's watch this video.
The death toll from the coronavirus in the U.S. climbed to 9 on Tuesday, all in Washington state, where health officials are battling a cluster of cases. More than 100 people have been diagnosed with the coronavirus nationwide. Among the latest, a New York man from the Westchester County town of New Rochelle, a suburb of Manhattan, where he works as a lawyer. New York Governor Andrew Cuomo.
We have a case in Westchester, a 50-year-old gentleman who did not travel to any of the places that are on the quote-unquote watch list, did travel to Miami, but that is not a place that we have known that there's any cluster of coronavirus. Our information is the gentleman had an underlying respiratory illness, and he is ill, and he is hospitalized.
New York City Mayor Bill de Blasio said the school attended by one of the patient's sons in the Bronx has been closed as a precaution. That son is not exhibiting any symptoms of the virus, also known as COVID-19. Another son, who attends college in New York City, does have symptoms, Mayor de Blasio said, adding that both sons are in isolation in their Westchester County home, their test results pending. The director of the World Health Organization warned on Tuesday that while the symptoms may be flu-like, right now the coronavirus has proven to be more deadly.
While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected.
As the nation braces for more cases, transit workers in New York City, with its over 8.5 million people, were seen wiping down hand railings and subway machines, and store shelves that once stocked hand sanitizer and face masks are now mostly empty. Trump administration officials have said they are working to increase the number of available test kits, but Washington State Democratic Senator Patty Murray, outside of a Senate hearing with health officials Tuesday, expressed concern that testing efforts are falling short.
They're only doing 100 a day right now in my state, where we have a prevalence of sick people. And we're told, well, there might be 1 million by the end of the week, but no proof that we really do, or how people even get that test if they feel sick and don't know where to go.
President Trump, who toured the National Institutes of Health in Bethesda, Maryland on Tuesday, said his administration is working with Congress to pass an emergency spending measure to help stem the virus, adding that he expects lawmakers to authorize about $8.5 billion.
Damn.
The coronavirus emergency, the death toll in the U.S. rising to 9, all of them in Washington state, as new cases appear in more parts of the country. We get more now from NBC's Miguel Almaguer.
Tonight in Washington state, the outbreak turning deadlier. At least 9 fatalities and more than 30 confirmed cases of the coronavirus. Emergency crews responding again today to the nursing home where several patients lived who later died after contracting the virus. Others are still hospitalized in critical condition. 26 firefighters who helped the sick are now off the job, many with flu-like symptoms.
This really impacts the community, right? Our ability to keep the community safe.
Across the country, in the nation's most populated city, New York officials confirm the coronavirus has infected another patient. Hospitalized in serious condition, doctors are now tracing his movements. The man, a lawyer in his 50s, who lives in Westchester and works in New York City, may have been exposed in the area. His family quarantined at home. 7 employees at his firm are being tested, and the schools his children attend are now being cleaned.
This is a crisis that will be with us, I think it's fair to say, not for weeks, but for months.
Fighting the virus and public fear, tonight there are more than 120 confirmed cases in a growing number of states. In North Carolina, their first patient, the person exposed after visiting the nursing center in Washington state. Back near Seattle, a government building closed as a public school reopened today after one of its students tested positive for the virus, 4 others being monitored.
I feel like I'm sending my son to death, basically. I mean, it's just unsafe.
Washington's governor saying the public should consider avoiding large events and assemblies.
We are not making a request formally right now for events to be canceled, but people should be prepared for that possibility.
Tonight, growing concern over the unknown, a deadly virus quickly spreading as health officials urge caution while trying to ease fear.
Some of the patients who tested positive for the coronavirus are being treated in the hospital behind me. They're in critical condition, fighting for their lives. Meantime, local officials here in the Seattle area say they're working to buy a local hotel to house the sick, a clear indication they expect those numbers to also rise. Lester.
Yeah. All right, Miguel Almaguer, thank you. We'll be right back with more breaking news on the coronavirus, including today's big move on the economy and the run on supplies.
So here we have someone who lives in North Carolina that visited this nursing center in Washington State, and they're infected. So that's what I mean when I say this is scary because of how it's being spread so easily and quickly. And we have, across the country. We have someone who visited Washington State and brought it back to North Carolina. And God knows how many people they were around before they realized that they were sick. Well, Ellie, just make sure you keep an eye on her if it turns into anything more. Terry K, they said 9 days on surfaces. Agenda Free TV. Let me check it out. There's a lot of good videos out there. You just have to search for them. Oh, here is something live right now.
As Congress, when we actually doubled the NIH budget many years ago, that was actually also a congressional.
Oh, they're talking about the budget and all of this. And as you can hear, it's going to cost our country billions of dollars. It's just crazy. It's crazy. Okay, so this is called Agenda Free TV.
Welcome to Agenda Free TV. I'm Steve Lookner. I am the news anchor and host.
All right, let's see. Streamed 15 hours ago. Let's watch this.
It. But anyways, you can listen to that there. But so the UAE, it's interesting. The UAE is canceling school for 4 weeks. I saw I think earlier about the UAE today. This was interesting. It said UAE, this is from Zaid Sabah. This was earlier today. UAE reports 6 new coronavirus cases. Patients are 2 from Russia, 2 from Italy, 1 from Germany, and 1 from Colombia. Now, hold on a second. This was update. I missed the update. All 6 foreigners in UAE caught the coronavirus from 2 foreign. Update on 6 new UAE cases today. All 6 foreigners caught the coronavirus from 2 foreign infected cyclists. So according to the UAE, They're saying that all 6 foreigners in the UAE caught the coronavirus from 2 foreign infected cyclists who were participating in a sporting event in the UAE. You know, when you see stuff like this, if this is true, suggests it spreads pretty easily.
So yeah, as you can see, it's just like I was saying, it spreads so easily. These cyclists were infected and they participated in a sporting event, and there you go. I mean, that's the scary thing, guys. Oh, mind crime. Go take care of hubby. I mean, all right. So, I mean, that's pretty much the update. Just, you know, be aware, subscribe to these channels, watch their videos, High Figure Skating Coach. Keep informed. Get some medicine, get some hand sanitizer. You know, just practice good hygiene and, you know, do the best that you can. I mean, that's really all you can do. Oh, yes, they do have that live. This is okay. I'm going to subscribe to them too. Thanks, you guys, for all of these sources. Here is a live update. And you heard that the ones that were in the hospital in Washington are in critical condition. Those are the patients from the nursing home. Just to be clear. Yes, Cheryl, if you get sick, please go to the doctor. Well, they don't have tests. If they think you have it, they will gather samples and send to the CDC. They say they are working on a vaccine. Yeah, it's going to take months, but I worry about a vaccine. I don't even take the flu vaccine. All right, guys. Well, I think we're pretty much up to date. I mean, all we can do is be vigilant and make sure that we wash our hands, cover our mouths, all that good stuff. Yeah, a year to a year and a half for a vaccine is what I heard yesterday, too. So hopefully they can get this contained. I think that we're going to do a good job here containing it. And Kathy, I agree with you 100%. Wash your dang hands. Yep. All right, guys. Well, stay safe. Stay clean and healthy. And if you're sick, stay home. And I'll keep you updated when I get new info. I find pretty cool videos on this, and I'll share them with you as they come up. Okay. So thanks for being here with me, guys. Good morning to everybody. Have a wonderful day. I'll see you tonight. I have a live scheduled at 9 p.m. tonight. And you're gonna wanna hear this out if you've been following this case. I'm gonna have Angela Cannon on, whose daughter was murdered. She has some things to say. So I'm glad you found my live too, Terry. One reporter here is sick, and they told her she was not sick enough to come to the hospital yet. So are they telling her just to stay home? Yeah, I mean, I care about all you guys. I want everybody to stay safe. I don't want to hear that anybody's sick. So everybody just be vigilant. It's spread like the flu virus, and the incubation is 2 weeks. Yep. All right. Yes. Peace and love to you, ocean lover. I'm an ocean lover as well. You guys have a great day. I'll see you at 9 p.m. tonight. Come join me. Bye, guys.